So, if you are looking to get advice on what you should do as it pertains to purchasing a health insurance plan through the healthcare marketplace, or maybe getting a membership plan with the primary direct care provider, I'm going to give you my expertise on what I think is best to do, what I think is wise to do. Come on, let's go. So, first things first, I'm going to give you the pros, in my opinion, on direct care, primary direct care, and tell you a little bit about what that is. So, direct care, they're providers who are not affiliated with insurance companies. They are private owned companies that will offer healthcare services to their clients. It's membership based, so you pay a minimum amount most of the time, and you're able to have unlimited visits. They're able to see you in office. They are able to provide you with physicals, and they're able to provide you with services that you would typically get from your primary care provider at a reasonable rate. Now, the beauty of this model, in my opinion, is that you get to build rapport with the provider. You have a relationship. They probably know you by name. They don't just look at you like, I think I know who you are. And they actually know, what your issues are or your non-issues are. But you have a relationship with this extra provider. And like I mentioned, the rate is reasonable. So you don't really have to worry about unexpected charges, pretty much knowing that you can pretty much be seen for any type of sick visit and feel comfortable and confident knowing that it's not going to break the bank. I think this is a really good option for people that don't have ongoing issues. I think this is a really good option for people that may be younger and healthier. I think this is a good option for people who want to have rapport and they want to have a relationship with their provider, with their doctor, with their nurse practitioner. I do think that this is a great option for people that those things may be a great fit for. Now, as a health insurance broker, some of the cons that I see is that the major medical piece is missing. This is probably the biggest reason why most people should have insurance is for the unexpected. So while you'll be able to go see this doctor, whenever you need to for a set rate, they'll know you by name, they'll know about all of your issues, they are taking really good care of you. In the event that an emergency happens, they will not be able to assist you. They won't be able to service you. At this point, you'll have to go to the emergency room or you may have to be admitted into the hospital. And this is where the real money kicks in. This is where people have to pay hundreds of thousands to millions of dollars in medical bills because of unexpected experiences or emergencies. Now, I'm going to tell you about the pros of having health insurance, and we consider this also major medical insurance. So typically when you are getting major medical health insurance, to your annual visits, they're covered at 100%. Some even cover your sick visits. They have unlimited sick visits, or they may have a certain amount of unlimited sick visits where you can be seen. You also know that you're covered for specialist visits. So outside of just that one provider, that may not specialize in dermatology, skin, they may not specialize in heart, so cardiologists, or they may not specialize in whatever it is that you may need. You have access to actually go see these providers, and there's a cap on what you will actually have to pay, because with health insurance, you do have a deductible and you do have a total out of pocket. So in comparison to the direct care, they may just specialize in primary care, which is typically sick visits and things that they can handle in office. But if you ever have to be referred, this again is where the money kicks in. This is where you will be falling short and could potentially be set back. So to add to that, with health insurance, it's kind of your key to be able to get into the door, to be able to be seen wherever you need to be seen. Whether you've had a relationship or not is really based upon what your needs are. And in my opinion, you need this cushion. You need to be this reassurance that if anything, especially the unexpected happens, that you'll be covered, and also that there's a cap on what you will be responsible for. Now, some of the cons of health insurance, it may be maneuvering through the enrollment process. It may be understanding networks. It may be understanding deductibles and co-insurances and maybe things like that, which this could be resolved by working with a local agent, a local broker, and having them to explain these things to you as it pertains to your specific needs. So if you are young and healthy, it's okay to have a direct care membership, but I also think that it's just as important to have insurance as a backup plan, just in case the unexpected happens. So I hope this has explained the two, and I hope I've helped you to be able to make an informed decision. If you need assistance enrolling, visit that link in my bio. I hope this helps.